We are now going to jump over into that mobile app. So the mobile app, you will see it on your desktop of your tablet or device as the ESO icon. As soon as you open it, it will take you to this login screen here. The first thing you do is you type in your username, and then we type in our password. Before you hit let's go and log in, if you need to address the onboard keyboard, so if you have a tablet or a laptop that already has a keyboard attached, the very first thing you're going to want to do is turn off that enable on-screen keyboard, because the most aggravating thing in the world is if you have a keyboard on your device, but the one keeps popping up on the screen. You can also sync to update your mobile app, to update it with any software pushes that our developers have done, or any updates that your department has made as far as admin changes. So you would just simply click here, update system data, and it's very quick and it's done. And now when we're ready, we'll just hit let's go. And we are now in the mobile app. So if you're going to be assigned to a unit for a period of time, you can come in here and set shift. We can select another provider. I'm just going to say it's me and Donna. We can select what unit we're on. We can select that unit's capability, its level of care. You can select the vehicle, the shift, and you can select the device and hit OK. And what this is going to do is for any report that you generate, it's going to automatically pull all this information in for you. So we're going to do that in just a moment. If we're ready to generate a report, we click the green button here that says New Record. If we want to view our history of faxes, how many we have pending, successful, or failed, or we can view that fax history. If your administrators have sent you any messages or alerts. And we can also see how many calls we have that are synced or unsynced. If we want to sync a record over to the desktop version, we just select it and hit sync record and it will take it over for us. So if I want to do that, boom, all done. You can view your history of records here if you had any that were not synced. And you can also log in to view any messages. So if anyone has sent you any QM messages, you can log in and view those, and it's the same username and password. So I just come back here. If I'm ready to generate a report, I'm going to hit New Record. So again, this opens up exactly like the desktop version. It looks very, very similar. The only differences are going to be this icon here. So if you are integrated with any of your partnering agencies and they are ESO users, you will be able to transfer your PCR wirelessly from the mobile app to their mobile app. So let's say that you're treating a patient and another ambulance is inbound to you, or maybe you're going to the hospital and you want to go ahead and send that record over to the hospital. You would click here and you would hit transfer patient. Select which agency you want to transfer it to. You can type them a message if you want and hit transfer. It's going to give you a 4-digit code. All you would have to do is either on the radio or by phone, give that receiving agency that 4-digit code. They would click in their app and hit receive patient, and they would be able to pull that patient report into their system. And then lastly, we have the timeline here. So you would be able to see your timestamps for anything that you've done here within the call. This is not in the desktop version, only in the mobile app. Okay, so we're going to document a PCR. I'm not going to go quite as slowly as I did in the desktop version because I want you to see that it can be done in a reasonable amount of time. I may document a few things that aren't necessarily your validations, but I just want you to see the full scope of the system. So our run number, I understand your agency has a process for run numbers. I'm just going to do test. That way you know it's a test call. It's for training. The first selection is run type. You're going to see these quick selection boxes, and these are dynamic, which means they will change. These will reflect your most frequently used picks. So if we hit other, you can see the full menu, and these will be the most 3 frequently utilized. So I'm going to select 911 response. Our response mode, we're going to say emergent, which triggers a few more things. We're going to say we responded lights and siren with the normal light pattern. We'll select the station. We'll just say central station. And you see all this information here is already pre-populated. That came from where we set up our shift back on the home screen. We can select a vehicle if we need to. And then we come to our EMD complaint. And again, these are dynamic. You can see your full list of things here. You could type in the search bar to find what you're looking for. I'm just going to use breathing problem. Was EMD performed? We're going to say no. You can document what zone you were responding from. This will help your department be able to explain any extended travel times or anything like that. So we're going to say we were responding from zone 1. Who requested EMS? We're going to say the patient. And we'll say the first initial responder was on scene between 5 and 15 minutes, and we were the first. We come down to scene. So you have different options. Within admin, if you have locations that are frequent flyer locations or places you visit very often, your department can build those in as location types, and it will pre-populate for you when you make that selection. If you need to manually do it, you just select address. We're going to select our location type. We're going to say it's a home or residence. You can get a little bit more specific and say exactly where they were. If I'm looking for a private residence, we'll say they were in the, say we found them in the kitchen. We're going to come down and we're going to type in our address. I did a quick Zillow search earlier just to find an address that was actually in your area. You can document any additional address information, apartment, suite, room numbers. We come here and click this magnifying glass. It's going to do a zip code search based on the information we've given the system. And if you're in Crawford or Harrison County, we'll just pick one. Got it. And again, we can select our zone. Which zone was this incident in? We'll say it was in zone 1 as well. Was this a mass casualty? And our triage classification, we'll say walking wounded. Our personnel, it has already pulled them over. If we need to add additional crew members, we click the green button and we can do that. If you have any interns or student ride-alongs, you can document them as well by hitting add non-crew members, and you can free type in their information. We look at our validations. You can see we have 16 things, but we do need to document the roles of our providers as well as their PPE and their certification license numbers. So I'm going to come in here to Donna, and I'm going to say that she was the lead. For PPE, we'll say she just wore gloves. We're going to do the same for me. I'm going to make my life easy and say all I did was drive. Certification, I'm just going to pick one, and I'm just going to make up a number for me. I'll say NA and hit OK. We look back at our validations. You can see those items are gone, and we're down to 11 things. As soon as I tell the system that we have a patient, though, that number is going to go up. So as we scroll down, now we hit our dispositions. So we select unit. Did we make contact? Were we canceled prior to arrival? Let's say we made patient contact. You can see now that number's gone from 11 to 23. Did the patient refuse care before or after evaluation? Let's say that we evaluated and provided care. Our crew disposition. Did we initiate and continue? Did we transfer to another EMS crew? What did we do? We're going to say we continued it. Our transport disposition. Did we transport by, did we do it or did we transfer it to another EMS? We're going to say that we transported. Select a mode. We're going to say it was non-emergent. So no lights, no siren by ambulance. Why did we transport? Let's just say the patient was adamant they wanted to go. And we provided a BLS service to this particular patient. We check our validations. We're up to 56 items because now it knows we had a patient that we transported. Sounds like a lot, but it'll go fairly quickly. Come down to our destination. So if hospital is already predefined, we'll select which hospital. We'll say Baptist. We can select a department, as well as is there a designation for this particular hospital. If you want to get a chart number, you can scan it with your camera. Documents patient number, STEMI registry, stroke registry, if we want this report to be reviewed. And then we come down to our times. So we're going to hit set times. Let's say dispatch received this call at noon today. And keep in mind, as I'm documenting different things in the report, you're going to see me adjusting the times. If you were on your mobile device, it would be time stamping each action that you make. Call received, we'll say we were dispatched at 12:01. We went en route at 12:02. If you had to stage for law enforcement to get there to ensure the scene was safe, you can document your stage times. If someone other than you was the first responder on scene, you can document their time. We're going to say we arrived on scene around 12:10, at the patient around 12:11. Let's say we departed the scene for the hospital around 12:30. If you arrived at a landing area, you can document the date and time. Say we reached our hospital around 12:45, transfer that patient at 1 o'clock, and we'll say we closed that call about 3:15 once we deconned and restocked. If you wanted to document when you return to district, you could do that as well. Let's just hit OK. You can see all our times are here. We have our response time interval measurements. So a total response time of 10 minutes. That's going to be from dispatch being notified until we arrived on scene. We were on scene for 20 minutes with a 15-minute transport and a 30-minute turnaround. If you're unsure about what any of these terms mean, you can click View Definitions, and it'll give you the time intervals that are included in each one of those. We have a total call time here of 75 minutes. And then we come to our delays. If you had a delay in any of these response time intervals, you could document that delay. If there were none, you can just hit the none box. Turnaround. We'll just say cleanup. Got it. Come down here to mileage. You would type in your scene and destination mileage. So let's say we're at 1,000 miles on scene, and we'll say 1,015 miles when we got there. Total loaded mileage of 15 miles. If there were any additional agencies that were on scene or additional responders, you could document that. And these are all pre-built out for you by your administrators. Was someone else the first agency to provide care? Was there anyone else there, maybe an off-duty firefighter or off-duty LEO, something like that? And you can free type any additional comments. We look at our validations. We have 43 items. You can see exactly what tab they're in and what they are. You can also see our timeline based on what we indicated on that basic page. Move on to the patient tab. Since this is a training call, I like to give my patient a name that I know is bogus. So we'll do delete, delete. We're going to say that patient is a male. We can enter a date of birth or estimate an age. I'm going to do a date of birth. If you have been to this patient within the defined interval that your department has set up, it could be 30, 90, 180, 120 days. You would be able to go back and pull in some information from previous charts. Again, you can do that driver's license scan. You can document their weight. It automatically converts from pounds to kilograms for you. If you want to estimate their height, you can. Say 6 foot. Document a race and ethnicity. We come down to contact info. Again, you have the unable to obtain option. If it's the same as the scene address, you just hit copy scene and it will pull that in from the incident tab for you. You can grab a phone number. I'll just say the patient refused to give it to us. Does the patient reside in the service area? Yes or no? We'll say yes. Are they a veteran? We're going to say no. You can document their primary physician information as well as any advanced directives that they may have. We get into our patient history. So who do we obtain it from? We'll say directly from the patient. Add history. Okay, say they have a history of anxiety disorder with panic attacks. Come down to allergies. Let's say they're allergic, they tell you they're allergic to aspirin. And we can also document their medications. Okay, we could add comments. Okay. Again, we could document those belongings. Let's say Mr. Delete left you with his car keys. Got it. You can add details. Given to. Got it. Okay. We're going to come in here to our vitals. So we can bring in directly from a monitor. I don't have access to your specific monitor, so we'll just have to do this. Just do a quick demo. And here you can see, we'll just pick one. We'll say Coach Quest. I'm going to import. Okay. And there you can see your vitals that came in directly from your monitor. If you don't like this, you can always come over and undo your import. And we can manually add our vitals. We can grab a quick blood pressure. Let's just say 160, 100. How did we get it? Let's just say from a manual cuff. We can do a quick pulse rate. Document the rhythm, as well as the strength. Okay, we want to finish this out. We can do respirations. We can document end tidal and CO and get a temperature, as well as a BGO. We can do our GCS scoring if we like. Just max amount of 15 with no qualifier. Document ECG information. And we can do pain scale, either a face pain or our numeric chart. Okay, and here we have a full set of vitals. We can view our scoring, view ECG information. Let's check our validations. See, we're down to 23 things. We've got to do a patient assessment and then some things in our narrative tab. We want to do any treatments for this patient. Again, you would select the correct category. Let's just say we gave this patient a little bit of oxygen. Say via non-rebreather. 15 liters per minute. It was successful. Donna did it. Say the patient improved, no complications, and we did it by standing protocol. Okay, so now we have one treatment documented. We move on to our assessments. Remember, we have 3 different types. So if we want to come in here, I'll make sure I get my time right here on this patient. Mental status. So he was a little agitated. He was ANO times 4. Skin. Same thing for the chest. We'll just say no abnormalities. Sounds are good. Nothing with the lungs. Document the abdomen, or we're good if we just want to stop. Check our validations. You can see we've satisfied it. If you want to go back in and finish that detailed assessment, you can just click in there and you can finish that out if you like. Check our validations again. We're at 22. And you can see some of those are in the narrative tab. We have a little bit of billing and then the signatures that we have to wrap up. Hit OK. Let's go into that narrative tab. Primary impression. We're going to say acute respiratory distress. Secondary impression, anxiety. I think somebody else is trying to join, so let me let them in really quickly. Oop, I did not mean to deny them. See if I can fix that. Okay, if they join again, I'll let them back in. Sorry about that. You can document your protocols. Document your local level of care. Your chief complaint system. Say this is a medical, it's not a trauma. We can add signs and symptoms. Okay, hit OK. We've added both of those. We need to select which one is our primary. Let's say this patient was last known well today around 11 o'clock. Is the onset time an estimate? We'll say yes, but they said they started feeling bad around 11:30 today. Do you suspect a stroke? I do not. Chief complaint, we'll say a panic attack. And going on now for about 30 minutes. For a secondary complaint. Got it? We can document initial and final patient acuity. Document their activity. What were they doing at the time? We'll say unspecified. Their level of distress, we'll say mild. And anatomic location, we'll say global. If this were an injury, if you select yes, it gives you a drop down of a lot more information you can document about said injury. Are there any barriers to care? We suspect alcohol use. And let's say they were just generally uncooperative and in a state of emotional distress. The alcohol, we'll say we smelled it on their breath. They admitted to it and we saw containers. Pregnancy was not a factor. How was the patient transported? How were they moved to the stretcher? Are they moved to the ambulance? Or are they moved from the ambulance? And how were they positioned during transport? And when they got there, what was their condition? We'll say he was improved. And then we can type our narrative. We just click the green button here. And I'm just going to do something very basic. Got it? All right, we check our validations again. We're down to 5 things, so we're almost done. And just so you know, if you wanted to, you could just click. It would take you directly to that validation. So you can document all of your payment information. For me, I'll just say there was no payment info. Our response urgency, we'll say immediate. You can document your dispatch nature. You guys want CMS level and work related. And then we'll scroll down to work related. And we'll say it was not. You can document their employer, their contact, add phone numbers if you like. And then the very last piece here is your provider signatures. So we're going to grab these. We'll let Donna sign. If Donna's watching, I apologize, but I'm probably going to butcher that signature. And then I will sign as well. Hit OK. And if we're done, we see we have the big green check mark. Our number is 0. So if we're all done, we come here and we lock this record. So you now see it's changed to the padlock. So the report is locked. Would you like to print or fax? You can choose to do so if you like. We can come right here. We can go back. We want to view our records. We have this here. We have the option to fax it. All these options here if you have the appropriate security role. We can come down here to sync records. And we can sync it. Now, if you remember at the beginning, I showed you how to share that record with another agency. Keep in mind that's only available in the mobile app. Once you sync this record, it moves from the mobile app to the desktop version, and you no longer have that ability to wirelessly share. So if you're going to do the wireless share, just make sure that you do it before you sync it, okay? And I would get in the habit of syncing these records at certain intervals because they will fall off out of the app and you will lose them over a period of time. And your department can see what that period of time is based upon their settings in the admin console. But if I'm ready, I just hit sync record. And we are all done here within the mobile app. If we jump over into the desktop version, still here. I want to see my records. There's our patient, Mr. Delete Delete. That's the one that we just did. So folks, we were sitting a little over an hour. That is how you document a basic PCR in EHR. What questions does anyone have for me so far?
Will we have access to this recording so that in the future, when we're playing around on it, we can come back and look stuff up if need be?
Absolutely. As soon as we're done, I'm going to stop the recording and I'll share it with your administrator and they'll be able to share it out with the agency as they see fit.
Fantastic.
I would strongly encourage everyone to get in and do some training reports. I mean, again, that's up to your department, but really the only way to get comfortable and competent in any system is to get the reps in. So I would definitely want to do some training reports before I go out there and actually start documenting with a real live patient.
Sean, this is Mike Hunter.
Hey, Mike.
Hi. So I don't know who asked the question about having access to the recording, but once you send it to me, I will do a little bit of editing on it and then put that into our learning management system. Okay, I'm gonna share that with you tonight. So as soon as we're done, I'm gonna send that over, so you'll have it this evening. That's fine. Thank you. Yes, sir. Absolutely. Any other questions at all?
When we transfer over the vital signs, will we be able to, will we have to do anything special for our strips to transfer over? So like a 4-lead, are we still going to have to go in and find the strip button and transfer it, or?
As long as your agency has it configured correctly with ESO, you should be able just to pull it in just like I showed you from the mobile app. It should do it wirelessly.
Gotcha. And this may be more of a question for administration. Are we going to be able to access this from our personal cellular devices, or is it going to be limited to the computers only?
Sean, I can answer that.
Okay.
So you'll be able to access the EHR anywhere from any internet connection, but they will have multi-factor authentication enabled in it.
Clear. So if I had a report that I needed to add, that I put gloves on or something, I could open it up at my house and be able to throw that on there real quick.
So, Sean, I heard your question, Keith. Sean, did you touch on once it's locked, they can't change any clinical information?
That is correct. Once it is locked, unless you have the security role enabled to unlock it, and as Mike said earlier, not everyone will have that role, you would not be able to unlock that report. You would have to have the security role to be able to go in and unlock it. So you can see right now for this, I can't go in, I can't make any changes to this because it's locked. If I had the security role, I would go in, I would unlock it. But just keep in mind that ESO does timestamp who and when any EHR reports are unlocked, and that is requestable if there's ever a court case or anything like that. So it does timestamp all of that. But in theory, if the call is not locked, you would be able to go in from any device, anywhere, as long as it's a call that you have access to, and make any changes that you would need, if your department allows that. But the system won't stop it, I guess is a good way of saying it. Any other questions?
Does this system have the ability to retain and import frequent flyer type patients?
Absolutely. As I showed you in the desktop version, it's coming to the mobile version, but it's not there yet. Let me go back down to mine. Actually, let me open one that's not locked. That's where
My
the
phone
longitudinal.
froze. May have been what happened.
Say that. I'm sorry. Say that again.
I could have missed it. My phone froze for a few minutes.
That's okay. That's okay. This is a new release for the web version. It is coming to the mobile app. It's just not there yet. Longitudinal records, as long as you have the first name, last name, date of birth, and one of these three fields, whether it be Social Security, phone, or address, you'll be able to see every interaction your agency has had with that patient.
Go ahead.
I have some questions back here. I'll make sure everybody can hear it.
Sean, can you hear Mike Carson in the background?
I can hear a voice, but I cannot hear quite what he's saying. So if you could
Okay.
relay it, that would be great.
Hold on, he's coming up here by the mic.
Okay.
All right, we're having some questions in the classroom. I just want to make sure everybody can hear it. Emily asked if people are going to have to sign at the end of every report in the signatures, and the answer to that is yes. Keith, can you mute the microphone, please? All right.
Yes,
We're gonna
you guys
start
do have
the-
that turned on as a validation, so it does require those signatures. I did check that last night to make sure.
So if you want to move your run from this to the computers, you would sync it without locking, correct?
Right.
But you don't have to move everything to the computer, you can finish it
Yes.
on this.
The big benefit of the mobile app is that you do not have to have cell service to use it. So if you're in an area, whether it be a rural area or maybe you're in a type 1 concrete building and you don't have cell service, you can use that mobile app in that area of no service. And then when you exit that area, you can sync it with the desktop version then. A prime example is in our downtown area, we have a large jail, type 1 concrete construction. The second we step inside, we have 0 bars of signal. But we can still do that PCR in the mobile app, and then we just sync it when we walk back outside. So that's another benefit of that mobile app. I believe he asked, is he still going to have to obtain a signature on paper, or is the ESO digital signature going to be adequate for you guys? I think that's what he asked.
It's the same as now. You can do either or.
So it will, as long as you guys have made the agreement to share your data, you can import your records to the hospital. They can become part of that holistic system record. And that's where tracker and outcomes comes into play, that you'll be able to see that patient as they move from your ambulance through that hospital system, either to transfer to another facility or ultimate discharge. Yep, any connected hospital. It won't be all, just the connected hospitals.